Hi, I'm Steve Adubato, and we kick off this program talking everything you need to know about healthcare with Brian Gragnolati, President and CEO of Atlantic Health System, and actually just came back as we're taping this program from Washington, D.C., the American Hospital Association, where you were the former chair. First of all, welcome, Brian.
Thank you, Steve.
Talk about that meeting in D.C. and why it was so significant.
Well, you know, it was the first in-person meeting that we've had at the AHA since 19. And that in and of itself was pretty important and was very well attended. We had well over 1,000 people from across the country there. And the mood was just a sense of relief almost that we could come together as a field and have some really important conversations. And so it was nice to be there and nice to see colleagues not on Zoom or Teams, and to engage in conversations outside the meeting room. So all in all, it was several days well spent.
And I'm sure, and first I want to disclose that Atlantic Health, one of the significant underwriters of our healthcare programming at the Caucus Educational Corporation. But Brian, I'm curious. The major issues that were discussed, I'm going to assume, but correct me if I'm off base here, that obviously the long-term impact of COVID on the hospital industry and on those who work in hospitals. But one of the things along those lines is there a, quote, great resignation going on in the world of our hospitals? Brian?
You know, you're right about the workforce concerns, and that was a major topic that was discussed in both plenary as well as breakout sessions in terms of strategies to deal with that. But that's clearly the case, and as you and I have discussed before and have discussed with others, this has been a long period of time that this pandemic has been going on. Here in the New Jersey area, for example, we were first in and saw more intensity really than any other place in the country, because at that time we did not know what we were dealing with. And now, as we've gone through these various iterations of variants and the impacts on that, people are fatigued. And so it is causing a resignation from healthcare in particular, as it's affected other industries. But healthcare, it's been pronounced. And so there are a number of strategies that we've taken here at Atlantic, and then, you know, were discussed over the weekend. But it starts in
Washington with your colleagues across the country.
Yeah, across the country. But it starts by listening to your team members. You know, you've seen recently that Fortune named us for the 14th consecutive year as a top 100 employer, but there were only 8 healthcare organizations this year on that list. And I think that talks a little bit about what's going on in healthcare. But it all starts with listening. You've got to obviously address issues around compensation, because, you know, it's a competitive environment for a limited supply of folks who do this kind of work. But the most important thing, and something that we've been doing as a company for a long time, is how do you grow your own? How do you introduce people into the healthcare field? Maybe they start in dietary or housekeeping. How do you understand what their aspirations are and what they want to achieve? Or how do you help them create those aspirations? And then how do you put the support around them so that they can achieve those? So we have programs like School at Work. We work with community colleges to give people a chance to be what they can be in healthcare. And I think that that's one of the keys to our future, to replenish our ranks. And I know here at Atlantic, we're having those conversations and taking those actions, and we have been for years, but we've doubled down on that. And that's what I heard at this national meeting.
Brian, let me ask you this, the nursing crisis. First of all, the term crisis has been overused in some ways, but there clearly is a crisis going on in nursing. The issue of, quote, traveling nurses, more and more nurses not affiliated with a hospital or a hospital system, but moving around from place to place. So I'm sure it fills gaps, but there are issues and problems associated with it, not the least of which is how expensive they are, A, and B, does that not send the message to, quote, staff nurses, hey, wait a minute, I can make more money if I'm traveling around? That can't be a good thing for the healthcare system and the patients and families you serve.
So, there's two sides to every story. So
At least.
as I've told you before, I round a lot in our hospitals, and I talk to our team members. And, at the beginning of this latest surge that began in January, I was rounding on some of the COVID units, and I ran into a nurse manager who had lost a couple of her team members to become travelers. Now, the odd thing was that those travelers were to go within the state of New Jersey, which is not the intent. So there's a flaw in the system that really enables that, because that's really not the purpose. But the real issue there for the team members was that they could make a significant amount of money in a short period of time, which helped them pay off their student debt, or gave them funds to be able to go to become a CRNA or something else. And so my point of view on that is understand where they are. Again, listen, see if we can create programs that can help them. But in the meantime, while they go away, make sure that our arms are open, so when they come back, we're there for them. And I think that this is a cycle that we're going through. I think we don't have enough capacity in nursing schools right now. That's why we're having conversations with several higher learning organizations to help do that. And the big challenge are clinical preceptors. And so
what does that mean? What's a clinical preceptor? Got about a minute left. Go ahead. What's a clinical preceptor?
Sure. So I'm sure early in your career, somebody was at your shoulder trying to help you do what you do. And that's really what a clinical preceptor does, because we know that the educational curriculum doesn't necessarily cover it all. And when you get into a clinical setting, you need somebody at your shoulder and at your elbow to do that. My daughter, for example, just became a physical therapist. She went through a PhD program. She's working, but boy, does she rely on her mentors who are at her side in the practice she's in now in Boston, in the Boston area. And that's really what we need to do. So if you step back and think about a lot of people that are retiring earlier now, maybe 55 or something, they're retiring because they don't want to take a full load of patients in nursing. You give them these roles where they can be mentors and teachers. And I think we begin to bring that back in balance. So here at Atlantic, we put on a very large effort, a symposium, to try to make sure that we were looking at this problem holistically. And I think we've got some good solutions that are really emerging.
Brian Granulotti, President and CEO of Atlantic Health System. Brian, I want to thank you for joining us. We really appreciate it.
Thank you.
I'm Steve Adubato. That's Brian Granulotti. We'll be right back right after this.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Northward Center, the Port Authority of New York and New Jersey, TD Bank, New Jersey Sharing Network, NJM Insurance Group, Summit Health, Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, and by Johnson & Johnson. Promotional support provided by the New Jersey Business and Industry Association and by Jaffe Communications.
Hi, I'm Dr. Sharif Elnahal. Did you know that there are nearly 4,000 New Jerseyans waiting for a life-saving transplant? And 67% of those people are people of color. Just one organ and tissue donor can save 8 lives and enhance the lives of over 75 people. Let's come together to raise awareness in our diverse communities. Donation needs diversity. You have the power to make a difference. For more information or to become an organ and tissue donor, visit www.njsharingnetwork.org.